Hey everyone, it's Amanda. Welcome back to My Life, My Way. Today we're going to start a new segment on my channel called TTC Tuesdays, and it's just going to be an informational sort of segment once a week about different things in regards to TTC and infertility, and it's going to go, back to the basics, like how to or what conception is supposed to look like, to different types of infertility, different treatments for infertility, some of the natural stuff we're using, different information about like diet and exercise and all that kind of stuff in relations to kind of the TTC and infertility world. So in order to help me make these segments, I've picked up two books that were recommended to me by women on the infertility pages that I'm on. The first one is this one. It's by the Mayo Clinic. It's their Guide to Fertility and Conception. I just started reading it. I'm only about 3 chapters in, and I've already learned things I didn't know, and I've been TTCing for almost 2 years now. So there's going to be some information from those books come up. The other book that I bought is this one. This is Taking Charge of Your Fertility, and it's written by a woman who has a master's in public health, and she's also a reproductive educator. So she's got some great information in there as well. Today, I think we're just going to start out with something easy, and we're going to go into just some basic abbreviations. I was laughing with somebody the other day, it's actually a couple weeks ago now, about how many abbreviations there are in the world of TTC. I'm pretty sure there is more that I use on a regular basis in TTC than I use in my work as an EMT. Oh my god, there are so many of them. So without any further ado, we're going to talk about different abbreviations. Okay, so let's start with some just basic terms that we use in the TTC world. TTC being the first abbreviation, which is trying to conceive, and it just means trying to have a baby. A couple you'll see regularly also are CD, which is cycle day, because everything in fertility land has to do with what cycle day you're on. And you'll also see AF, which is ant flow, which is just a nice way of saying you're on your period. So the first day of your period would be cycle day 1, and then it kind of goes out from there. Baby dust is another term we use a lot of. It's not an abbreviation, it doesn't get abbreviated, but baby dust is basically just like good luck to somebody else trying to get pregnant this month. For those of us that are suffering from infertility, it's not just, a little bit of good luck and ta-da, you're pregnant, because there's a lot more work and a lot more effort that goes into getting pregnant when you're suffering from infertility. But even when you have a perfect month where you've timed your ovulation and you've timed your intercourse and you had your IUI and everything was on point, sometimes you still don't get pregnant, and it's just sometimes you need that little bit of extra good luck into getting pregnant. There's just luck that's sometimes involved, which is rather unfortunate for us that are actually trying, but it is kind of the way it works. So you'll see a lot of people wishing other people baby dust, and it just literally means good luck in getting pregnant this month. Another abbreviation is DH and DB, which means dear husband and dear boyfriend. And some people also referring to their family will say DD or DS, which means dear daughter or dear son. Okay, so let's move on to fertile signs. So when women are checking for fertility signs, they might be checking things like cervical mucus and position. We'll be doing ovulation kits and all kinds of stuff, and there are abbreviations for pretty much all of that. So checking cervical mucus is called CM, or is abbreviated as CM, and then your fertile mucus is called EWCM, which is egg white cervical mucus. Cervical position, the fertile time of it, is abbreviated as SHOW. So it's soft, high, open, and wet, which will tell you that your cervix is in a fertile position. BBT is also checked. BBT means basal body temperature, and some women will check it every day, and it will confirm ovulation for them. Lots of other women like me also use OPKs, which is an ovulation prediction kit, and it's checking for the luteinizing hormone, or LH, in your system that surges just before you ovulate. And the last one for fertile signs you'll see a lot of is BD, which means baby dance, which means to get it on. I've also seen it abbreviated as DTD, which means do the deed, which is pretty much along the same lines. And it just means go have a little bit of fun with your husband tonight. For the actual pregnancy testing, POAS means pee on a stick, and it just means you're going to go take a pregnancy test. We usually check with FMU, which is first morning urine. It's the most concentrated form of your urine to do a pregnancy test with, but there are lots of people that will test in the afternoon on like a 3-hour hold. But you'll see a lot of people say that they've tested with FMU around. 2-week wait, or TWW, is this infamous wait between when you ovulate and when you can do a pregnancy test. It has shortened up a little bit because pregnancy tests have gotten more sensitive, but generally speaking, you're waiting 14 days between when you ovulate and when your period shows up. And it's that time where you're not sure whether or not you're pregnant yet. And a lot of times if you test too early, your pregnancy test will still come back negative even if you're pregnant. So it's this awful, awful, heartbreaking time where you just have your anxiety set to pretty much as high up as it'll rev. DPO is days past ovulation. So we'll start with day 1 past your ovulation, and you count out the 14 days till your AF or your period shows up. And you'll see people saying that they're testing at like 9 DPO, which just means 9 days past ovulation. HPT is home pregnancy test, and there are a bunch of different brands. So there's FRER, which is the first response, early response. It's really common. It's one that'll test up to 6 days before your period. Lots of people are also using CB, which is clear blue, or CBD, which is a clear blue digital. And it just is different names for different types of pregnancy tests. As for the results for the pregnancy tests, BFP is what everybody's going for. BFP is your big, fat positive. That's pretty much the whole reason everybody's in for TTC. The other side of that, unfortunately, is BFN, which is a big fat negative. And for anybody that's following me that's also got infertility, you know entirely too well what a BFN looks like. Line eyes isn't an abbreviation, but it is a term we use a lot of. Line eyes literally means you've been staring at the stick for so long you can't tell whether or not it's positive or negative. And people will actually post pictures of their pregnancy test to infertility chat rooms going, somebody please help me out because I cannot see, I have line eyes. And they're just looking for some assistance and people to kind of help them out. HCG is human chorionic gonadotropin, and that's the hormone that your pregnancy test is checking for. And then EDD is your estimated due date. And pretty much every app, if you put in that you got pregnant, will take what day you got your, what day you started your last period, and will estimate 40 weeks ahead to your estimated due date. All right, let's move on to different kinds of treatments and stuff and what the abbreviations for them are. Okay, so let's start with IVF. IVF stands for in vitro fertilization, and it's a treatment for some women in order to get pregnant. But there are different abbreviations inside of the IVF world. There's ICSI. I have to actually pull up my page a little bit closer. ICSI means intracytoplasmic sperm injection, which basically means they take the sperm and they stick it into the egg. And it's used especially in people that have sperm issues where they can't break through the wall of the egg in order to fertilize it. PGS is pre-implantation genetic screening, and it's used to ensure that the embryos that they're going to use for IVF are healthy embryos to give them the best chance of being of conceiving with it. PUPO, that one caught me off guard the first time. PUPO means pregnant until proven otherwise, and it's basically the time from when their embryos are transferred back into the woman's body until you can do your pregnancy test and get your AF at your 14 days. So they use pregnant until proven otherwise specifically for IVF because they have a fertilized embryo hanging out in the uterus waiting to see if it implants. BCP, it just means birth control pill. The reason I put it in the IVF section is because lots of women, when they're getting prepped up and ready for a cycle of IVF, they'll be put on the birth control for a month and then taken off so they can start their cycle. And then you see DPT, which means days past transfer. And it's often abbreviated sort of like 5DP, 3DT. And literally it means that it's 5 days past a 3-day transfer. And you'll see different variations with different numbers. But the 3-day transfers or 5-day transfers are very common. And it just means they've let the embryo grow in a petri dish for 3 or 5 days before they're put back in the body. And that first number with 5 days past means how many days it's been since they put that transfer in. And you kind of have to add the numbers up to look for where their ovulation date would have been. So it's a little bit weird and a little bit bizarre. But once you start getting into it, once you start learning where they're going with it, it's not so bad. And we'll do, I think, some informational sessions about IVF in this TTC Tuesdays. just so that you can understand what they're going through, even if IVF is not going to be the option that you take. IUI is also a really common procedure for people suffering from infertility. IUI stands for intrauterine insemination, and basically what it means is they take the man's sperm, throw it through a washing machine, take out all the semen portions of the sperm, they take your concentrated sperm, and they put it back up into the woman's uterus to kind of take out all of the sort of wars of getting through the cervix and up into the uterus by themselves. It just kind of takes out some of that work for them. And then you'll hear things like DPIUI, which means days past their IUI, and it works kind of like an ovulation date. For the testing, there's a couple that are really common. SA means semen analysis, pretty self-explanatory. HSG is I'm going to give an attempt at saying this out loud, hysterosalpingogram? I've had one done. They're fairly painful. I think we're going to talk about one of those in another TTC Tuesday kind of days, because what it means and what the results are will mean a lot to you. But basically, the test is to check that your fallopian tubes are open. Some conditions that are really common that you'll see kind of float around the TTC world. PCOS is polycystic ovarian syndrome. It's one of the number one reasons for female factor infertility. It's what I suffer from. PID is pelvic inflammatory disease, and it's usually an infection in the pelvic area that can cause infertility as well. And the other one I have here is OHSS, which is ovarian hyperstimulation syndrome. It's usually associated with IVF medications, and it's just because they've tried to superstimulate the ovaries and they've basically just kind of kicked out. And there ends up being a whole bunch of side effects to it. It's what everybody's trying to avoid when they're doing IVF. When we're talking about loss, because that does happen, and you'll see a lot of it go around on infertility websites. MC means miscarriage, and your angel baby is the baby that you've lost due to miscarriage. And it doesn't matter if you lose it at 4 weeks with a chemical pregnancy or you lose them at 38 weeks with a stillbirth. Those are all angel babies. And the last term I have for you is a rainbow baby, which is a baby that's born after you have a miscarriage. So for those of you guys who have been following me around for a while, you know that in January we also had a miscarriage, and we now have an angel baby. We lost him at 8 weeks of gestational age. We didn't find out till about 11 weeks before the miscarriage actually started. So I had a missed miscarriage. Missed miscarriage is another one that you might see go around, and it basically means that the baby has died, but your body hasn't started the process to return itself back to a normal state and void yourself of that baby. And yeah, so now from now on, I'm actually looking for a rainbow baby, which is that baby born after a miscarriage. So yeah, so that's pretty much it. That's all I have for abbreviations. There's probably more, because I've probably missed a couple. If you have other abbreviations that you've run into that you didn't see on this, throw them in the comments so that anybody that's watching that's new, that might be into this TTC world and being really overwhelmed by how many abbreviations there are, because I have 2 pages of printouts sitting in front of me. At least then they have a bit of an idea of what we're all talking about. That being said, if you are new into the TTC world and somebody throws out an abbreviation and you don't know, ask. All of us will respond back, and it's not a problem. But that's it for this TTC Tuesday. If you have a request for topics we'd like to see, let me know. Throw them in the comments. And make sure that you like and subscribe so that you see you next Tuesdays. I'll talk to you guys later. Bye.